Hi everybody, as Rakesh said, I am Ellie. Just going to talk to you quickly today about successful patient partnership. So just a little bit about me first and my interest and experience with this topic. So I'm both a patient partner myself and I have a couple of autoimmune and hereditary connective tissue diseases, and I'm also a researcher. So this means that I hold two of the roles that we think about when we look at these partnerships. Before I got into academic research, I started off in healthcare research, working predominantly with pharmaceutical companies. So where I've worked with quite a few different stakeholders and groups now, I've seen how fragmented everybody can be in research, especially in terms of working with the patients also. I often feel like it's kind of an afterthought for people to collaborate with each other sometimes, but I've seen how much better it makes it all round if you have those strong, genuine relationships with members of the public. So I'm very passionate now about trying to push forward that better collaboration across healthcare research. So I became involved with this work because I became a patient, right? I was diagnosed with my diseases, but this was very much not part of my plan. I thought my life was going in a very different direction. So my first point on partnership is that I think this is very helpful to bear in mind. It can be why lots of us as patients get involved in research. We feel pulled to it through sheer necessity sometimes. The type of autoimmune diseases that I have are notoriously difficult to diagnose. They have a lot of symptoms, and most of them are rare diseases as well, so they're not well known by HCPs. During my journey, I was therefore turning a lot to the charities and the support groups for our diseases, and that's how I got involved in research as a participant, first of all. So if I saw something that I thought looked interesting or addressed a question that I thought I wanted answered, I took part because I wanted to help answer it, and I wanted to get sent the results afterwards of what had happened in the study. So at the same time that all this was happening, I was going through university. I was on a general business management course because I was trying to find what I wanted to do with my life now that the symptoms had made some avenues that I was previously exploring impossible. And I was writing my dissertation at the end, which made me realize actually I really enjoyed doing research. So I started off in retail research and I did my master's, but I was increasingly finding that the work I was involved in as a patient was just a lot more interesting and meaningful than the topics I was working on. So that's when I decided to transition into healthcare research. Again, I would say at this moment, for kind of full disclosure, when we're thinking about partnerships, I went to the London College of Fashion. I wasn't particularly interested in biology or the sciences at school. So I think it's a really good example to show that with the right support, and I've had amazing mentors and teams along the way, it really doesn't matter what your patient's education and background is. They really can come to understand how research works and make that huge contribution to it. And then due to my declining health, I went freelance in 2023. I started going to even more events and taking part in more stuff run by the support groups and the charities. And this is when I met Mel Sloan at a Lupus UK event. She was giving a brilliant talk on mental health in our diseases, and it really reflected my experience and it really resonated with me. So I contacted her afterwards to say I'd love to be involved in the research however I can, and that's how I became a patient partner with the long-term conditions group at the University of Cambridge. So I thought it would be helpful here before I start going into my experiences and kind of some top tips for patient partnership to kind of look at the evolution of it quickly and do a quick overview of the topic. I'm sure there's probably people on here that know the kind of origins of PPIE much better than I do, but since I've been in this arena, there has started to be more of a push now with some of the leaders in it and the national bodies like the NIHR to have us move away from this consultation type involvement at the top, and to a certain extent even the co-design that we've seen developed over the years. The cynic in me thinks at some point people realise that the cost of not involving patients before that moment, you're suddenly asking for informed consent and recruiting everybody, is probably incredibly high when you get it wrong, and maybe we need to start involving patients sooner. You've got no idea what you've got wrong until you hit that point if you haven't asked anybody. I think perhaps that was the case more than a genuine understanding of all the benefits of patient partnership in the beginning. But thankfully, I do feel with what I have worked in, things are finally starting to change in a more holistic way. I work very heavily in rare diseases, and I can see why and how co-production and patient-led research is happening more there. I think it's easier in well-established disease areas to read a huge amount of literature on the disease, a lot of it probably without any PPIE at all in it, and to kind of not speak to patients and think, oh, I've got a really good understanding of the disease now and probably what it's like living with it. But in rare diseases, some of them don't even have that huge amount of literature or research that's done already. So I think I've seen it happen more organically, people inviting patients to the table, because you need to rapidly fill in those knowledge gaps. And that's one of the straightforward, obvious ways to do it, is to ask the patients. So in terms of the benefits that it can bring, firstly, just from a patient partner perspective, I think there's numerous benefits, to be honest. Firstly, here's having meaning for being involved in research. When you are a participant, you can see how the research is going to be of benefit. Like I said, I would see questions that I wanted answers, but you're involved right at the end stage. If you spot questions that aren't relevant to your experience, you can't do anything to change that, and you can't give that feedback as to why something isn't exactly the most helpful way of doing it for you as a patient. You can help to improve the experience of all patients in key areas. For example, our work is heavily in things like mental health, hormonal issues. That's something that I and a lot of people in our group have experienced ourselves. So it's nice to be contributing to the topics that have had the biggest impact on us. A lot of times, my personal experience has been that it gives meaning to and can reconcile some of the more difficult healthcare experiences, because at least it's creating that drive for change once you've been through those difficult things. And a huge benefit as well is feeling, especially in our group, that we're changing the journey for the patients after us. A lot of us have had to tread difficult journeys in terms of diagnosis and finding the right treatment. So we just want to see those journeys be easier for the people that come after us. And a lot of the time, actually, there can be unexpected benefits to being involved in research as a patient partner. Again, because I do a lot of work in rare diseases, you might not meet another person with your disease before. So even just making that connection can be incredibly meaningful. And when you work on these projects and you meet new people, you don't always know where it's going to go. And actually, again, in our group, it has led to some really amazing projects and opportunities for a lot of the patients that have been involved. And again, there's the benefits for the researcher. And I think some of these are things that we all think about, and some, again, are maybe ones that we don't quite fully understand. So there's that direct understanding of the patient experience. For me, my experiences of my diseases are by no means prescriptive of everybody that has those diseases. So it's really helpful for me to hear from other patients on our projects to get an understanding and their insights, because they're things I wouldn't have thought of myself, even though I live with these diseases. I think inevitably you will save on time and resources if you involve patients from the beginning and you have that trusted continuous feedback going on. Another thing that I often mention here as well is that I think in healthcare, we completely abandon sometimes some of the really basic stuff. I remember being so core to my business degree, and one of those is to talk to and know your end user, right? We've got this added complication in healthcare where I think sometimes people think of the HCP as the end user, which that can also be the case, but ultimately it's the patient every time who will eventually be on the receiving end of whatever it is that we're looking into. So we need to have them on the team and designing with us and working with us. So now that we've gone through the evolution of kind of how patient partnership has come to be and some of the benefits that it brings, I thought I'd do a quick whiz through some of the top tips I got for applying it from my experience in the projects that I have worked on. So firstly, finding your patient partners. A good starting point for this is the charities and the support groups for the conditions that you might be looking into. The NIHR also has great advice on doing this, but from my own experience, the best thing you can do is get out from behind the desk and try and go to the places where the patients are going to be. So there's lots of events and conferences now that are often run by the charities or the support groups, where patients are there, and often sometimes patients are the speakers, and it's just a more organic way to get to meet people in person and start to form those working relationships. So start somewhere. Obviously, we want to eventually be working towards that idea of like patient-led research and genuine co-production, but it can be a very new way of working for some people. So even just doing some kind of co-design activities with a small group of patients is where lots of genuine partnerships do start. Then you really want to start thinking of patients as another colleague or team member. Often really good working relationships, they can't be rushed, so you have to allow time for that trust and communication to grow. And it's the same thing with your patient partnerships. You have to be open-minded to other people's experiences and ways of working, because the whole point of the patient partnerships a lot of the time is to allow them to help you to see things you wouldn't otherwise have done when you're doing your research. So to reduce that overall bias in the team, you have to adapt and find new ways of doing things. That's absolutely part of the process of building the partnerships. Then you start to build your patient partnership involvement earlier and earlier, ideally, into your research. You want to be getting to the point where when you are thinking of new ideas or you're applying for new research, they are right there at the beginning and they're helping to guide you as to what you should be doing next. You don't need to have formal priority setting activities. You don't need to have a James Lind Alliance budget. This is something you can absolutely do with your patient partners. I've seen, small charities and organizations help researchers do this, and then it helps to guide the research across groups for that particular area, which is really helpful. So design your groups intentionally as well, in just the same way that you would take this into account when hiring an employee or making new connections to the group. Think about what skills or expertise you're lacking, or particular experiences or perspectives that you need to start filling. You want to try and get the full patient experience as much as possible covered by the people who are your patient partners. And to prep your patients separately, taking the time to do this will absolutely pay you back threefold, I promise. Research is an entirely different language to most people. So if you want to get the most out of your patient partnerships, you have to lay some foundations first. And by this, I mean, give your patients a really good foundational understanding of how research happens, and in particular what your research is about. You'll get more confident contribution and insight that way. And the best ones I found at the moment are Imperial College London has got really good resources for doing this that you can access through the NIHR website, where everything's broken down into small modules. So patients can do as much or as little as they want, and they can get a kind of certification at the end to show they've got that baseline understanding and research, which I think is really helpful. And finally, just consistent communication throughout. Have 1 or 2 points of contact, and give people fair notice and timelines in terms of attending meetings, and also compensation, which I'm going to talk in a little bit more detail about here. So the first thing I would say is co-authorship. So this is something that we do as standard in our group. If somebody contributes enough to meet the requirements for co-authorship with a journal, then we will offer it to them as standard to be listed as a co-author. And then a newer thing as well is putting people down as a co-applicant on applications. This would probably be with people that you've worked with before, and once you've got those partnerships going and they've been successful, as well as recognizing them and their contributions, it does help to kind of push the whole agenda of patient partnership forward. And most bodies are fine with this, whether it's an individual patient or whether it's somebody that represents a charity or a support group. They will encourage you to start doing that now. Conferences and social events are another really good way to compensate your patient partners. I think including patients in this way really cements them as another member of the team, another equal in your research team, and having that same opportunity to be involved. And the more that you go to conferences and events like this with patients, you get that positive cycle repeating itself, where you're then more likely to meet more members of the public who are involved in this area and would be interested in being involved in your research group. If you're taking more members of your team, you'll all meet people and make connections, and hopefully things will grow from there. Personal development is a really interesting one. When you think about a research study, there's actually quite a lot of different tasks and skill sets that need to be covered. And this is where patient partners can play a really helpful role, and it can also help with their personal development with goals and progressions that they might have in mind. So, for example, I've got a friend who is a lupus patient, and she works with a research team for social media and kind of sharing their research when it's done that way. And that's obviously quite a new and innovative way of sharing research. It's not necessarily the norm yet, but it means that their research gets spread to a wider audience, and she's now built up a portfolio to be a freelance marketing content creator. So it's helped them both kind of push forward the progression of what they needed in the group. And then finally, remuneration. We have recommended rates for that with the NIHR, which is incredibly helpful. I think it's just something to bear in mind when doing new funding applications, to really put in the full and fair amount needed to compensate your patient partners. This is understood now not to just be a nice add-on. It's a legitimate expense for your study, and funders should be recognizing this when you put it in. So, as with any new way of working, there can be some challenges, but it's all things that you can work through as a team with your patient partners. For this first point here, we do a lot of work in mental health in our group. So this is particularly relevant. We've had to think about things like safeguarding, having charity partners that offer mental health support, and having the psychiatrists and the psychologists on hand. I think what's important to emphasize is to say to patient partners that they can speak up anytime if something is too distressing to be involved with, and they can leave things at any time. I still have to do this myself with certain topics, and step away if I'm finding it too difficult. It can be difficult as well if there's opposing views or if conflict comes up, but I've always seen this as a reality of working in a research team. If the answers were obvious into what we're looking into a lot of time, there would be no point to our research. We wouldn't need to be doing it. So there's going to be conflict between people, and that can be the same sometimes with the patient partners as well. I think it's just the key thing is that everybody is allowed to have their views, and everybody's views should be treated equally, regardless of their role or the status in the team. And if you've got that respect and equal status understood by everybody in the team, I think that's what's key to working through any conflicts or differences of opinions. Again, we touched on this point earlier, that we have at times got to adapt the way that we work to complement our patient partners, and to recognise the way everybody works as an individual. This means that some patient partners actually won't find working the same way as each other even is something that is complementary for them. So it's something we're looking into our team at the moment, to have kind of different levels of involvement that are kind of defined by the tasks and the time commitment and things like that, so that patient partners can have flexibility to be involved how much they want to. And then by predefining the levels, the rest of the team understands what exactly those mean. And then as far as compensation goes, the challenge again can just be having the conversation with patient partners. I think it's just best to raise it when you are having a discussion at the beginning, and being fully open about how you can compensate. At the same time, you discuss things like what tasks they'll be involved in, what the time commitment to join the team would be, and to allow people to decide for themselves if it will work for their individual circumstances. And then finally, there is this ongoing problem with healthcare, with power dynamics, and that can unfortunately be present in the research team somehow. This is where that point I made before about preparation can be really key to help patient partners overcome that feeling of hierarchy, so that they feel more empowered to contribute fully, and that their views and everything are just as valid as everybody else's in the team. So I often like to finish when I do talks like this, just taking a zoomed out big picture view at the end on how patient involvement and partnership in research is still something that's evolving. So for example, the clinical trial legislation was updated last year in the UK, and although it was decided in the end that public involvement wouldn't be a requirement, a legal requirement, because it's not practical for all trials, there was then additional guidance published afterwards, and it made it clear that the law is to allow for the exceptions. The majority should still be trying to increasingly involve patients in their research, and there is these kind of minimum requirements in that guidance that was published afterwards. I've experienced myself actually the increased patient and public involvement with the MRHA. So in the last year, I've been working with them on the new rare disease framework, and it's very much been that genuine co-production with all of the patients that have been involved in the patient organisations, which is brilliant. And I'm hoping that it's working that way in the rest of the organisation, as it very much seems to be the tone from the top now. And then in the NHS England 10-year plan, we've got this phrasing here for a collaborative approach with patients and co-design to be the new norm. And again, I think it just emphasises what I am seeing in my own work, that by taking on patient partnership and investing in that working relationship, all you're doing is joining the tide that is already starting to turn, and you're helping to adopt and refine those approaches ahead of it, hopefully becoming more of the required norm in the future to have patient partnerships across research groups. So that is the end of my talk. I hope it was helpful. If there's any questions, I'd be happy to answer them.